Today, we have with us two eminent personalities in the field of Ayurveda, Dr. Professor M.R. Vasudevan Nambudiri, who is a senior consultant and former director of Ayurveda Medical Education Kerala, and who is a senior consultant at RAHA Ayurveda Hospital Integrated Ortho Neuro Rehab Cochin Kerala, and Dr. A.M. Anwar, who is the medical director of RAHA Ayurveda Hospital and Integrated Ortho Neuro Rehab Cochin Kerala, and who is a pioneer in integrating Ayurveda with modern medical sciences. First of all, I would like to thank Indian Embassy Kuwait, who has taken the initiative of spreading the science of Ayurveda to the other side of the world. Today, as we are celebrating National Ayurveda Day, this year our theme is Ayurveda for everyone. So, Doctor, I would like to ask you, in this modern era, how significant are the principles of Ayurveda and how can people adopt Ayurveda in daily lives?
Thank you, Dr. Shinsi. Let me tell a few words about Ayurveda. I wish to call Ayurveda as an Indian wisdom for global health. Actually, it is not for Kerala, it is not for India alone, it is not for Kuwait or alone, because it is actually for the world. In this era, our concept of Indian concept is that Vasudhaiva Kudumbakam, which means that universe is a single family. Hence we have to take care of every members of the family, not one member alone. Hence Ayurveda is a system of medicine which is meant for the health of the whole world population. There comes the relevance of Ayurveda in this modern era. Actually, Ayurveda takes care of pediatric care to geriatric care, sports medicine, everything is included in Ayurveda, by which we can provide health to all the sectors of life. That is the benefit of Ayurveda. Moreover, it is suitable for each and every climate. In some places, extreme climates may be there. Ayurveda explains the Ritucharya. According to the climatic variations, we have to change our dinacharya or daily routine. In that way also, Ayurveda is giving prime importance to health of the people by preventing the disease. First of all, prevention, then only secondly comes only the treatment aspect of Ayurveda. That is the benefit of Ayurveda, that is the uniqueness of Ayurveda.
Dr. Anwar, how can Ayurveda help us in preventing lifestyle diseases? Because we know lifestyle disorders are on the rise in today's world.
Thank you, Dr. Sinsi, for asking these very relevant questions in this modern world. Ayurveda, as everyone knows, Ayu means life and Veda means knowledge. It's a knowledge of life or science of life. It not only explains treating diseases, it has two equally important parts, Swasthavrta and Rogavrta. As Professor was explaining, Swasthavrta, if you are blessed with good health, then it's your responsibility to maintain it. Then if you become ill, then we have treatment protocol for Rogavrta. From 2000 to 2016, WHO has conducted a study on different diseases. Out of this, major 10 diseases, cause of death in developed countries and developing countries are lifestyle diseases. Infectious disease and malnutrition disease are a cause of death in underdeveloped countries or poor countries. It means that overnourishment, sedentary life, all contributing to these lifestyle diseases such as hypertension, diabetes, cholesterol, obesity, and all other lifestyle diseases, whatever we name it now. Ayurveda teaches, Ayurveda consider you or my life as a part of nature, and I receive all energy from nature in the form of water, food, and air. So we have to live a life in harmony with nature. Now everyone says organic food, organic farming. Ayurveda teaches organic living. So if except human being, everyone in the nature is living in harmony with nature. More than 8.6 million species in the earth, around 6 on the land and 2.6 in the ocean. We cannot see any hospital for animals or a birds or a plants Of course, there are hospitals for domesticated animals and plants when they become started living in the modern life. If they are living the natural life, there is no diseases. That's a teaching for us. Now everyone is looking for organic lifestyle. This is the advocation of Ayurveda. And Ayurveda consider your body as a wonderful working machine. You also need periodical service. A multi-layer filter, if it is blocked or clogged, you have to do a backwashing. Or you send your car for a service after running 10,000 kilometers to change the oil and clean the air filter. Similarly, our body is a wonderful working machine. Ayurveda teaches cleansing and detoxification, living in harmony with nature, diet modifications, lifestyle modification, exercises, keeping your mind, body, and your soul in a rhythmatic, in a balanced way. Every life is a balance. Your life also need to be in balance internally and also in balance with the nature. That is the cause of rise in lifestyle diseases. Then coming to your point in how Ayurveda is effective in this modern world for preventing lifestyle diseases. Knowingly or unknowingly, every house in India and in Asia and most part of the world are using Ayurvedic herbs or Ayurvedic medicines or even Ayurvedic food, which is detailed explained in Ayurveda. I'll give you some examples. In our kitchen, we use turmeric for daily cooking. It is explained in Ayurveda as curcum or curcumin or rajani. Or we use cardamom, we use garlic, we use pepper, we use cinnamon. These are all explained in Ayurveda as medicine and as ingredient to food. So we are using all this type of food on a daily practices. By adopting and by understanding the effectiveness of Ayurvedic herbs and using them in your daily cooking can also improve your metabolism, your digestion, absorption, assimilation, and excretion. When people say Ayurveda, it's not like simple taking massage or taking steam bath. It also part of daily routine. As Dr. Nambudiri, he was my teacher in my college in Trivandrum Ayurveda College. You need to do daily routines, seasonal routines, food habits, and moral code. You need to follow this. Ayurveda explains daily regimes. What are the good things you have to do from the morning when you wake up? So he always teaches a slogan, Brahma Muhurte Uttishte Swastho Rakshartham Ayusha. So wake up early in the morning and do whatever good for your maintaining your health. Similarly, Ridhucharya, seasonal routine. We all know that there are 4 seasons: winter, summer, autumn, spring. But in Ayurveda, it explains 6 seasons, like Sisiram, Vasantam, Grishmam, Varsham, Sharat, Hemantam. Whenever there is a change in the climate, it affects our body also. So we have to adopt daily routine, similarly seasonal routines, and also cleansing and detoxification and food habits and moral codes. This is the simple way of adopting Ayurveda to prevent lifestyle diseases.
Dr. Nambudri, are there any age-specific practices or considerations people should keep in mind when they think about integrating Ayurveda into their daily lives?
Actually, Ayurveda advocates treatment for all the age group from pediatrics to geriatrics. I already told you. But you know, the pediatric treatment doesn't start after the birth of the child. Even before the childbirth, you know, even the gestational period, we are treating the pregnant lady for getting a good or healthy offspring. From that day onwards, you know, we are starting treatment till the end of the life. Geriatric care is very important in Ayurveda because, you know, at that time people become more fragile to diseases. Hence, you know, we have to take care of their immunity. That is very, very important. Hence, you know, we are having good packages, good treatment plans for leading a very precious health with a very active life also. In that way, we are promoting geriatric care in a good way. That is in no other medical system, this much of geriatric care is not at all explained. For example, our Rasayana therapy is actually meant for geriatric care alone because it nourishes all the elements or all the dhadus in the body, by which we can enjoy health for a very long period.
Dr. Anwar, how does Ayurveda address mental well-being?
In Ayurvedic teachings, the base of diseases broadly classified into Manoroga Chigilsa and Sharira Roga Chigilsa. So he's teaching us Tesham Kaya Mano Pedam Adhishta Adhsanam Ditha. So that is mental diseases and physical diseases. And definitely it explains a detailed protocol for balancing your mental health. It also includes different therapies along with yoga, pranayama, and meditations. So, if you are mentally not good, mentally not fit, it follows many physical illness also. So, focus more of the mental health while you are treating even the physical disease. Some people they come with us even with irritable bowel syndrome, a gastric discomfort. So, we usually treat physically. Of course, treating physically is important. It is more important to understand the mental status of the patient and balancing or helping him to balance the mental status. Ayurveda has 8 branches of treatment which explain thousands of years. Kaya Chigilsa, I'm adding one answer to the question you asked to Professor Nambudiri. Kaya Chigilsa, it's general medicine. Bala Chigilsa, pediatric or treatment for children. Graha Chigilsa, psychiatric treatments or mental well-being. Shalya Chigilsa, surgical treatments. Damstra Chigilsa, Shalya Chigilsa, Damstra Chigilsa like toxicology. Shalya Damstra, and geriatric Rasayana Chigilsa and geriatric treatment. It is the first science which explained geriatric treatment. Now we know in all hospitals or departments we have geriatric divisions.
You see, as the life expectancy is increasing, the number of aged people or geriatric people are increasing in the society. Hence, that medical branch is having much importance in this current era.
Thank you, sirs, for your valuable inputs. Thank you, Indian Embassy Kuwait, for taking this initiative.